31,000 years ago on the island of Borneo, a child's leg was cut off. No hospital, no antibiotics, no painkillers. Just a stone tool, steady hands, and somehow the child lived. Not just survived the surgery, lived for another 6 to 9 years afterward. Today, we're going to find out how ancient humans performed surgery that modern doctors are still stunned by. We're going to crack open a skull, saw off a limb, and drill into a live tooth. All through the eyes of the people who lived it, tens of thousands of years before anesthesia, sterilization, or a single medical textbook existed. By the end, you'll understand why some ancient surgeries had better survival rates than surgeries performed in European hospitals in the 1800s. Picture a Neolithic village, somewhere in what's now France 6,000 years ago. A man is dying not from an enemy, but from the swelling in his own skull after a head wound. The bleeding underneath the bone has nowhere to go, so someone picks up a sharpened flint and starts scraping. This procedure is called trepanation, and it's one of the oldest forms of surgery we have hard evidence for. Archaeologists have found it on skulls across Europe. In some Neolithic burial sites, as many as 1 in 10 skulls show signs of a deliberate hole cut into the bone. The earliest confirmed case found at Ensisheim in France dates back over 7,000 years, and that individual had been operated on twice, surviving the first surgery long enough to heal completely before facing a second one. Why would you do this to a living person without anesthesia using a rock? 2 reasons, it seems. Sometimes it was medical, clearing shattered bone fragments and draining blood after a skull fracture, the same basic logic as modern emergency neurosurgery. Other times it may have been spiritual, an attempt to release whatever was believed to be causing seizures, migraines, or unusual behavior. Here's the part that should blow your mind. We can tell whether a patient survived by looking at the edges of the hole. If the bone shows smooth, rounded regrowth, that person lived for months or years afterward. And across sites in France, some studies have found the survival rate at 70 to 80%. Compare that to European hospitals in the 1800s, where skull surgery survival sometimes barely cracked 10%. Somehow, a Stone Age healer with a flint blade was safer than a 19th century surgeon with a scalpel. Part of the answer might come down to something modern hospitals didn't even realize they were fighting: crowd disease. Neolithic villages were tiny compared to 19th century cities, and researchers think the sheer absence of dense, pathogen-rich urban environments may have made open wounds far less likely to turn fatal. In other words, it wasn't that Stone Age medicine was cleaner, it was that the world around it was. Now to Borneo, tens of thousands of years earlier than anything we just covered. For decades, the accepted story of medicine went like this. Real surgery, the kind that requires understanding anatomy, arteries, and infection control, only shows up after humans settled down and started farming, about 10,000 years ago. Nomadic hunter-gatherers, the story went, just didn't have that kind of medical sophistication. Then in 2020, researchers found a skeleton in a cave in Borneo, missing part of its lower left leg and foot, and the bone had clearly healed. Dating techniques including radiocarbon and uranium series analysis put the amputation at roughly 31,000 years ago. That's not a small correction to the timeline. That's 24,000 years earlier than the previous oldest known amputation, blowing apart the idea that hunter-gatherers couldn't do advanced surgery. Think about what that operation actually required. Whoever performed it had to cut through skin, muscle, and bone while avoiding the major arteries and nerves running through the leg. Miss that step, and the patient bleeds out in minutes. Then came the part modern doctors still struggle with in the tropics: keeping the wound clean long enough for it to close without infection in a rainforest full of bacteria with no antibiotics. And somehow it worked. The child grew into an adult and lived for years after losing part of a limb. We don't know exactly what tools or plants were used to manage the pain or fight off infection. The rainforest doesn't preserve soft evidence like bandages or poultices the way dry caves do, But researchers studying the case point out that surviving an amputation like this, even for a few weeks, would have been virtually impossible without something to clean the wound and something to dull the pain. Whatever that something was, it worked well enough to buy this child years of life. Last stop, your mouth. In a Neolithic graveyard in Mehrgarh, Pakistan, researchers found something nobody expected. Teeth with small, precise holes drilled straight into them, on living patients roughly 9,000 years ago. The tool was almost certainly a bow drill tipped with flint. The exact same technology this community used to drill holes in beads made of turquoise and lapis lazuli. In a reenactment, researchers found that a flint-tipped bow drill could punch through tooth enamel in under a minute. 9 adults were found with drilled molars, some of them drilled more than once. One unlucky patient had the same tooth worked on twice, and another had 3 separate teeth drilled. What's strange is that not every drilled tooth showed obvious decay. So this wasn't just cavity treatment. It may have also been an early attempt to relieve deep tooth pain that we can't detect in the bone today. Either way, someone sat still while another person bore a hole into their tooth with a spinning flint point, and they came back for more. That's not just tolerance for pain. That's trust in whoever was holding the drill. A cracked open skull that heals, a missing leg that doesn't kill you, a drilled tooth more than once by choice. None of this fits the caveman stereotype of brutish people who barely survived the day. These were healers who understood anatomy well enough to avoid killing their patients, who knew how to manage infection without knowing what a bacterium was, and who had patients willing to trust them with a blade or a drill. Modern surgery likes to think it invented precision and care. Turns out, we just rediscovered it.